Welcome to Journey to 600. Today we're talking about peripheral nerves, specifically the upper extremity. We are going to have a brachial plexus review and then talk through the radial nerve, the median nerve, the ulnar nerve, and some other miscellaneous nerves on the brachial plexus. Let's draw it out. So you're going to have C5 through T1 labeled for the brachial plexus. On the top you will have RTDCB, which stands for Real Texans Drink Cold Beer. Just kidding, it stands for Roots, Trunks, Divisions, Cords, and Branches. Then you will have two arrows, and those will be connecting to C5 and C6, and then C8 and T1. Then you will have three lines across, two little waves under the branches on the bottom two lines, and one big wave coming down from the top all the way to the little bottom wave. Then you will have forward slash between the three lines under the division section, and then one backslash on the top part of the division section. Then you will have two coming off of the roots at C5, but the one that comes down actually connects to C6 and C7, and then you will also have a 1-3-1 coming off of the cords. Then you will have two coming off from the trunk. Next, labeling the branches, however you want to remember it, MARMU, M-A-R-M-U, however it works best for you. MARMU makes no sense, but that is what it is. And those peripheral nerves are musculocutaneous, axillary, radial, median, and ulnar. Then under cords, on the top will be the lateral pectoral, on the very bottom will be the medial pectoral. The ones in the middle are a little bit harder to remember, but you have the upper and lower subscapular and the thoracodorsal. Then under the trunks you have suprascapular and subclavian, and under the roots you have dorsal scapular, and then the one that goes really long is the long thoracic. Lastly, just labeling those cords. So knowing the cords can kind of help you keep track of where the lateral pectoral and medial pectoral are. And in the middle is the posterior cord, but it's a little hard to see since this picture is 2D, but that cord is more posterior when you're talking about real anatomy. So starting off first, the radial nerve can be compressed or injured proximally or distally. So proximally, that is the PIN branch of the radial nerve, and distally is called Wartenberg syndrome. Proximally, the PIN branch of the radial nerve can be entrapped in the supinator, and it will have motor effects, which will affect the finger and wrist extensors. But the PIN has no sensory effects, so no sensory numbness or tingling for PIN. But you could expect a positive Mausley's test due to activating that forearm and finger extensor. You'll have a positive upper limb tension test of the radial nerve, pain with resisted supination since the PIN is entrapped in the supinator, as well as weakness in the forearm extensors. Distally, the radial nerve can be compressed between the brachioradialis and the extensor carpi radialis longus during pronation. This can be distinguished from the proximal compression since it has no motor effects, but it will have sensory deficits. So the sensory deficits are in the radial nerve distribution, which is on the dorsal side of the thumb and index finger. Positive special tests would include Finkelstein's and Tinel's. Finkelstein is administered in sitting with the thumb maximally flexed and the fingers wrapped around tightly over the thumb in a fist. You will stabilize the forearm and deviate the wrist towards the ulnar side. Finkelstein's is another test for de Quervain syndrome since it is in the same area, but de Quervain's is not the same thing as Wartenberg syndrome. The full clinical picture would be different. Okay, so next is the median nerve, and it has a lot going on. So it has three places of entrapment. First, we'll talk about pronator syndrome, and that is due to nerve entrapment between the two heads of the pronator teres. They will have weakness in the thumb, finger, and wrist flexor muscles. They will have sensory deficits in the palmar side of the thumb, index, and middle finger. They will be tender to palpate over the pronator muscle, as well as pain with resisted pronation. you will see weakness in the thenar muscles, and they would have a positive upper limb tension test of the median nerve. AIM branch of the median nerve, it is so close to pronator syndrome, and it is actually still entrapped by the pronator teres, but it's at the very edge. It will still have motor weakness, but it will have no sensory deficits. This is the classic inability to perform the OK sign pictured in the middle on the right there. Most commonly known median nerve entrapment is carpal tunnel. The median nerve is compressed in the carpal tunnel due to decreased volume of the tunnel or increased size of the contents. This will only affect the thenar muscles since it's more distal. It will still have sensory deficits. Positive special tests will include phalens, reverse phalens, upper limb tension tests of the median nerve, Tinel sign, and you could also see 8-pan. Ulnar nerve, it has two places where it can be entrapped. First one being the cubital tunnel syndrome, and that is where there's nerve entrapment in the cubital tunnel near the medial epicondyle, motor weakness of the adductor pollicis, interossei, flexor carpi ulnaris, lumbricals 4 and 5, and flexor digitorum profundus. Sensory deficits in the ring and pinky finger on both the palmar and dorsal side. You will see a positive elbow flexion test as well as a positive Froment's test, and you will have a Wartenberg sign, and a patient might have claw hand. Ulnar tunnel syndrome will have the same presentation, but the entrapment will be at Guin's canal. So, other nerves in the brachial plexus, but did not deserve its own slide. Here we have the dorsal scapular, long thoracic, suprascapular, axillary, and musculocutaneous. So I'm not going to read this out to you, but feel free to take a screenshot about where these peripheral nerves can be entrapped, what muscles they innervate, and will they have sensory deficits, and what exam findings might you see with these peripheral nerves being entrapped. Practice question time. A patient presents with numbness and tingling in her ring and pinky finger in her right hand. She has a positive Froment's test. Which of the following nerves is compressed? A. Median, B. Ulnar, C. Radial, D. Axillary. I'll give you a moment to answer this question. Feel free to pause this if you're not ready to go over the answer. We have to remember what peripheral nerve gives numbness and tingling to the ring and pinky finger. And what does Froment's test look at? So Froment's test is where you are pinching on a piece of paper and you have the inability to adduct your thumb. And this one's kind of tricky because you're like, thumb, that's like on the opposite side of the ring, and pinky finger, so what nerve is this? So this is B, ulnar nerve, because the ulnar nerve gives motor to the adductor pollicis, which when it is damaged will give you a positive Froment's test because they are unable to keep that thumb adducted on that piece of paper. And the ulnar nerve does give sensory distribution to the ring and pinky finger. Going back over some of these answers, the median nerve will typically give sensory deficit in the palmar side of the thumb, index, and middle finger. So this is not what is reported in the question. And then radial nerve will give rise to the sensory deficit in the thumb and index finger on the dorsal side. So having that sensory deficit in the ring and pinky finger should give you all the signs pointing to ulnar nerve, but if you needed something else to confirm that it was ulnar nerve, that would be the Froment sign. And axillary is one of those nerves that we didn't spend a lot of time on. The axillary nerve innervates the deltoid and the teres minor. So it is not going all the way to the hand. That would give that sensory deficit to the ring and pinky finger, nor would it be affected with the adductor pollicis. That would make a positive from its sign. So in summary, here is a picture of all of the nerves that we talked about today in the brachial plexus, and then also in this picture I have highlighted the sensory distribution and I have labeled the syndromes that we talked about today that give rise to the peripheral nerve dysfunction. So you can see where someone might complain of sensory disruption and predict what syndrome they might have. For a full chart detailing motor and sensory deficits as well as positive special tests, check out the link to the Etsy notes in the description of this video. The upper extremity nerve involvement document includes upper extremity dermatomes and myotomes that we did not cover today, but we will in the future. The special test notes will cover both the neuro tests we covered today and some ortho tests that we will cover in the future. A link to the brachial plexus notes includes muscles that are innervated by the peripheral nerves we talked today, and it just has way more information. Feel free to use this picture of the brachial plexus to kind of help you get a guide to label all those muscles that are innervated by those peripheral nerves. We'll be doing a video on neuro special tests as well as ortho special tests for the upper extremity at a later time. Thanks so much for watching. Be sure to like us on YouTube, subscribe to our channel, and turn on the notifications. Check out these other videos. We'll see you next time on Journey to 600.